or making threats of violence, we deploy police officers first, some of whom are trained in crisis intervention. And just yesterday, we announced that our brand new officers, 15 of them, have received the CIT training right off the bat before they set a foot on our streets to protect our citizens. Our officers also respond when the CRT requests additional resources like officers. And officers can refer calls for follow-up when the CRT is not on duty. When we put this program together, we built in a proactive and vigilant layer of safety to ensure both groups can effectively assist citizens in mental health crisis, our CRT team members and our patrol officers. I am proud to report these proactive measures have helped us keep everyone safe and reduce the need for difficult actions like arrest. To be clear, 0 arrests have been made in this pilot program when patrol officers have been asked by our CRT team members to assist on a call. 0 arrests have been made when officers have been called to assist. The licensed professionals with CRT have also improved the Baker Act process, which required law enforcement involvement by law. These professionals have the expertise to accurately discern when Baker Act is the safest and best tool to deliver immediate care to the person in crisis. At the same time, the CRT employs de-escalation training to the situation to further reduce any distress and make transportation safer. Immediacy is a key difference in our alternative responder model. Our CRT meets an individual at their moment of crisis, not hours, days, or later. By responding in the moment, the CRT, with the full support of the emergency communications specialists and our officers in patrol, can expertly assess a person's needs, de-escalate as necessary, and connect them to services in a matter of hours. I must commend the training and commitment the CRT, our dispatchers, and patrol officers have demonstrated during this pilot. The careful attention our officers and dispatchers have paid to CRT has empowered the team to safely and proactively respond to more calls with the approval of our watch commanders each time. The level of care the community response team provides each individual is another key difference in our model. Our CRT doesn't stop at the moment of crisis. They repeatedly follow up with each person to help them connect to valuable aftercare services. This follow-through ensures a greater number of citizens get real access to follow-up mental health care, housing, addiction treatment, and other local resources that might not be, or they may not have knowledge of when they're trying to get services, and it keeps them out of hospitals or the criminal justice system. At the Orlando Police Department, we recognize our community's growing need for mental health care. In our commitment to continue meeting the needs of our citizens, we are already working to double the number of officers trained in crisis intervention to approximately 500 by this time next year. We're also giving the CIT training to more emergency communication specialists, which means our citizens have more access to this specialized level of service from the time their call comes in and to the end of their interaction with our officers. Before I turn it over to the Aspire CEO, I just want to personally say, Lavetta, Latasha, how proud we are of the heavy lifting that you have done for the Orlando Police Department. This would have not been successful without your commitment and involvement, I'm sure. So for that, I have personal gratitude to both of you for what you have done.
Good morning. Thank you, Mayor Dyer, Chief Commissioners, for making this vision a reality for our community. I'm honored to be part of working with the leadership, with Captain Quinn Henry, with my Aspire VP, Aaron Martin, our CRT team, who recognized the need to treat individuals with behavioral health needs in our community with compassion. This year has been like no other. We've been faced with the pandemic, and we've seen unprecedented levels of mental health and the needs for mental health. The CRT team that is responsive in partnership with OPD and the city know the importance of being available and respond to the calls immediately as needed when dispatched. We've been able to help many individuals and families during this initial phase of the pilot, and we're extremely encouraged with the outcomes to date. Why would a team like the community response team be important, and particularly in our community? Well, first of all, we de-escalate crisis. When you look at the time frame from dispatch to response of an average of 17 minutes with somebody having a mental health crisis in need of an intervention, that is phenomenal. When you look at the model, the response team works during non-traditional hours. We are there when it is most needed, and we're there in partnership. From Wednesday through Friday, 9 a.m. to 1 a.m., Saturday through Tuesday from 2 p.m. to 10 p.m. What do? We're able to divert and link individuals with these behavioral health needs into integrated care and provide services by mental health experts. Each response team has a clinician and a case manager. The clinician is able to use his or her expertise from a clinical standpoint and provide those linkages alongside a case manager who continues to do that follow-up to make sure these don't become familiar faces in our system. We also are able to work with, as you heard, and educate law enforcement through CIT and through on the job while we're right there in the middle of an intervention. And we're able to provide follow-up to these most needy, vulnerable individuals who otherwise, without CRT and this partnership and the vision of the leadership sitting here, might not have a chance at having their mental health needs addressed. So far in this pilot, with over 500 individuals served by the community, more than 25% of them were in immediate crisis, high-level, acute, chronic crisis in need of services, and they were able to get those services they needed. 72% of those that we've served have been referred to services, and of those 72%, over 68% are engaging in services. That's more than 50% of those that we've touched receiving services. And you look nationally and even sometimes statewide at those in need of mental health services that actually receive the services, it's way less than 20%. This program makes a difference. The partnership between local government, law enforcement, and community behavioral health company proves that with key community stakeholders with differing roles and responsibilities, together we can come together for seamless services for those that are most in need in our community. At Aspire, along with our partners here, we are committed to continue to work on this pilot, see how else to advance it, and look at data to better the outcomes for the individuals that are in our communities that are so much in need of our care. Thank you.
Commissioner Stewart or Commissioner Burns, would you like to say a few words today?
Well, good morning. I'd like to say thank you to Mayor Dyer for his vision in making this project happen, because as we continue to kind of reimagine public safety and how we engage with our residents, addressing mental health is a key component of that, especially as we've been going through the pandemic. A lot of us are experiencing some mental health challenges. So I'm very supportive, and thank you to Aspire and their fine team and my fellow commissioners and Chief for making this happen. So thank you all.
Let me also express thanks. Mayor, thank you for your leadership on this. Babette, thank you for the work that you've done. With Kathy Russell, thank you for some great ideas that allow us to move this forward. We are always looking at ways that we can provide better services and do it less expensively. And one of the things that makes this work is that we were able to put qualified professionals out in homes, and to see the numbers of people that are referred means that they aren't likely to call again. And that's an important part of the work that we do. So it's not only just a dollars and cents good decision, it's also a good decision for our community for the long haul. So I appreciate all the work that everybody's done with it, especially that team over there. Thank you for being out in. Commissioner Burns and I both have a particular background in dealing with the most vulnerable of our community, and we know what it takes to accomplish that task. So thank you all very much for what you have done, and thank you, everybody.
All right, now we're going to go ahead and open it up to some questions. Does anyone have any questions for the leaders on the stage? Karen?
Did you find that you responded to one area or one district more so than others during this time that
I think we have a heat map that can probably be made available to the press, but the calls for service were all over the city. There wasn't one specific location. There's calls down in Lake Nona, there's calls down in the Central City, there's calls on the west side, so it's pretty evenly spread over the city. Ask that again.
the most frequent call that you guys got that was non-criminal in terms of community response?
Chief, who wants to handle that?
I think we should have the experts of the field come up and talk about
Yep.
it, if you don't mind.
Lavetta, why don't you come up too?
Yeah. Hello, I'm Erin Martin. I'm with Aspire Health Partners. I'm the Vice President of Patient Access. And this is my wonderful team. And Lavetta?
I'm Lavetta Quinn Henry. I am one of the program managers for the community response team, but my daily job is our community relations division. And so to answer that question, Erin,
Yeah, I think the majority of the calls have been the nonviolent mentally ill calls specifically. That has been the higher percentage of calls that they do get called out to.
So do we have a percentage or a number of times that police are actually called into these incidents?
So I will tell you that one of the things that we know is legally for a Baker Act, our patrol officers have to actually do the transport. So for those types of calls that resulted in a Baker Act, patrol was called to assist the team to actually transport them to Aspire Health for their treatment.
Do we have a number or a percentage?
So there is a percentage, it's
There's a
pretty,
Baker Act number, I believe, on there. Was it 120 something? Or 149, forget. It's about 25% of the calls that the team has responded to, just under 25%, where the clinicians have determined that this person is in a severe crisis, at risk of harm to themselves and/or someone else, but most often at risk of harm to themselves. And so they're doing the actual de-escalation, engaging clinically, and they're actually doing the Baker Act if it's necessary. And then they contact, via the police radios, law enforcement to do the transport.
Can you tell if this pilot reduced the number of people being Baker acted?
I don't know, because you don't know what might have happened should someone else have responded to the incident in question. So it might have been, honestly, one of the things of most concern is that they wouldn't have been addressed at all. Not because law enforcement wouldn't have addressed it, but because they may not have opened the door to law enforcement, or they may have been too afraid, and so forth. And so with a clinician responding to someone who's in a mental health crisis, there's a trust that's a little bit easier and a rapport that's easier to meet, and they're able to engage with that person. That person's more willing to open up and share what's really going on with them.
And Lavetta, maybe you can expand on this. Probably more than likely, it resulted in someone not having to go to jail and actually receive the services. It didn't escalate to the point where we had to make an arrest, and the person actually
And that was one of our anticipated benefits of having this program, that it would, give them the opportunity to get treatment, things like that. And so we've seen that benefit just because we've had our clinicians there to assess and connect them with services.